I've been in academics now for almost 50 years. I've been in continuing education for almost 50 years. I picked up a lot of tricks, and what I'm interested in is not how to make more money or how to be more efficient. What I'm interested in is how can I do a better job for the patient, for the customer, for the client, and how can I arm them with something that allows them to do a better job. And I'm a little frustrated. So this is about dental schools. Dental schools could change their programs very easily, put out better students, put out higher quality dentistry with just a couple of changes. One of the changes is right now, dental students primarily work by themselves. So they're terribly slow. If you paired up two students, you're going to have some conflict and have to change some of these. But if you paired up two students and they worked together, and while one was working, the other was assisting and photographing, and while the other was working, they switched roles. So you need one camera, you need students paired up, and the student has to learn how to take pictures, how to use magnification in display and documentation and communication. So you have a high resolution camera paired up, and now the chairman of the department, the highest level, the highest standard, could review all the work that's done in the clinic that day in 20 minutes, just going through the pictures. And if you had to take 7 pictures on every procedure, you can't believe how that would help the students learn. It would be better for the patients. It would streamline education. It would bring the quality of outcomes up to the highest standard of the highest professional in the whole school, in that department. And the students would get twice as much work done in half the time because they have an assistant. And the assisting dentist could see someone else doing things right and doing things wrong, and they can help each other and then reverse this. So that chairman of the department would go through all the procedures that were done that day, and they would take out the A's and the A pluses and put them over here, and they would take out the D's and the F's and put them over here. And then if you were consistently a C student, you have to go through 20 A's. If you were an F student or a D student, you'd have to look at 20 cases that were done properly. And honest, it's powerful what magnification can do in understanding and in application. And simple as a camera, high resolution camera, 4.5 power for every student, microscope training for every student. They don't have to use it the whole rest of their career, but they need to train under high magnification. They need to photograph under high magnification. They need to show what they did, why they did it, and how they did it on a high resolution display. And if you do that, the consistency and the quality and the outcomes of our dental professionals, our dental students, would go up. Their success when they got out and started their own practices would be tremendously enhanced, and the public would benefit the most from this. I have talked with several schools about this. There's so much political resistance to change that we haven't been able to do this. But as a patient, you can demand this from your dentist. You can make sure that they're doing high-resolution photography. You can make sure that they're showing you what they're doing on a high-resolution screen. You can make sure they're using magnification, at least 4.5. Training wheels are 2.5 and 3.5. 4.5, I think, is a sweet spot. Or find a dentist that does work under a microscope. All those things elevate the level of outcome and the precision. And dentistry is really micro-engineering and construction in spit. That's my joke for the day. That's Norwegian, they're not funny. Thank you very much for joining us.